So hi everyone, I'm happy to present my 6-month progress report. My PhD thesis title is The Effect of Oral Contraceptives on Metabolic Balance. My name is Árpád Jankó. I am a 6th-year medical student studying here at Semmelweis University. My supervisors are Szabolcs Várpidó and Márton Keszthelyi. My SMS is Isabel. And my vision would be to seek out the best oral contraceptive for optimizing metabolic parameters, and my mission would be to identify a high-risk population and determine an optimal combination based on these metabolic parameters. I have 2 projects at the moment. My first project is investigating the effect of oral contraceptives on carbohydrate metabolism. This is going to be a systematic review and meta-analysis. We started this project in September, and we plan on submitting it in April. A short background summary of my project. Oral contraceptives are one of the most commonly used forms of contraception. Over 70 million people use it globally. They're comfortable and they're quite effective. The 7% failure rate takes into account occasionally missed doses or other factors that can contribute to this number. With perfect use, their failure rate is under 1%. Besides its contraceptive benefits, it's also popular because they could reduce acne and dysmenorrhea. And as every medication, this also has side effects. Besides their well-known adverse effects, it's suspected that these could cause alterations in carbohydrate metabolism. So they could decrease glucose tolerance and increase insulin resistance, which could be risk factors for type 2 diabetes and cardiovascular disease. So because there are no conclusive guidelines in the matter, we would aim to assess the effect and safety of these medications on carbohydrate metabolism. We use the PICO framework, where the population are oral contraceptive users. Our intervention would be the drug itself, so we would be doing a before and after comparison. Our outcomes would be the metabolic parameters connected to carbohydrate metabolism. And our question would be, does the use of oral contraceptives have a negative impact on carbohydrate metabolism in women when comparing before and after usage? And our hypothesis would be that these drugs could worsen metabolic parameters. We conducted our systematic search in 3 different databases and got 15,000 results. And after our full text selection, I have 117 full texts that I extracted the data from. Unfortunately, at the moment, I'm not going to be able to show you concrete results. I had a lot of meetings with Peter. It's quite complicated with a lot of variables, but I can show some visualization of the data that I extracted into the Excel tables. Here we can see my primary outcome, OGTT, the glucose tolerance test. These diagrams are the means of the blood sugar values that were in the articles. The black dots are the baseline values, so before starting the drug, and the red dots are a after value after they started the drug. So this would be quite interesting and have a high impact after we see actual results, because these are one of the most, if not the most commonly used drugs in gynecology, and this hasn't been done before, so no previous meta-analysis has has looked at these parameters. There are previous studies where they looked at fasting blood glucose, but this is a static parameter as opposed to this tolerance test, which could give us dynamic information and therefore have a more detailed analysis. I zoomed into 2 diagrams here. The first one is diproteron acetate, and the second one is drospirenone. As we can see on the top diagram, the blood sugar parameters actually show us a worsened carbohydrate metabolism after use, while drospirenone could have a positive impact on carbohydrate metabolism. So after we have the mathematical model and see these results, this could help us in a more personalized drug selection when prescribing them to patients. So I think it's quite interesting and could have a lot of potential. As you can see, I finished my data extraction in January, and I'm actually finished with the risk of bias. And my second project is quite similar. It's going to be the effect of these contraceptive drugs on lipid metabolism. And a short background, these could have adverse effects in altering lipid metabolism, so it's suspected that they may cause increased triglycerides, LDL, or HDL, which could be risk factors for coronary heart disease. There aren't any conclusive guidelines here as well, so we aim to assess the effect of these drugs on lipid metabolism also. Our PICO and our question is quite similar, where our outcomes are a bit different connected to lipid metabolism, so we plan on checking LDL, triglycerides, and HDL. And our clinical implication would be to have a more optimized, higher level of patient care through the selection of the right medications. And to summarize, I have 2 ongoing projects at the moment. Both of them are systematic reviews and meta-analyses. The first one is investigating carbohydrate metabolism, and the second one is going to be investigating lipid metabolism. And as Kobe Bryant said, if you're afraid to fail, then you're probably going to fail. And thank you for your attention.
I would like to ask you about how long does it take until these metabolic side effects appear, and do you have any information about how chronic are these side effects?
Thank you for your question. Yes, in the studies that we selected, we have an after comparison at 3 months, 6 months, 12 months, and some at 24 months. So the top value is 2 years.
So first of all, I'm full of admiration for those guys like you who begin their PhD studies during their years as medical students. And the topic is very interesting, and you showed us data on progestins that were really interesting. What about the estrogens? I mean the estrons. Have you gone into details also for estradiol, ethinyl estradiol, or the brand new contraceptive estetrol? Do you have data on that?
Almost all of the articles that I found use ethinyl estradiol as the estrogen component. There were one article that looked at estetrol, so probably we won't be able to pool the data on that drug. But yes, we will look at estrogen and estrogen doses as well.
My question would be that both of your topics, the glucose tolerance, also the lipids, have many confounders in the population, like obesity, etc. How the studies deal with them, and how you are going to deal with them in your study?
Thank you for this question. This is something that I wanted to mention actually. We plan on doing subgroups. I have subgroups who look at diabetics, who look at obese patients. There are a lot of articles that look at patients with PCOS. So yes, of course, we plan on doing subgroups, and probably a good drug selection would be even more important to someone who has already a altered carbohydrate metabolism. So yeah.
Thank you, Árpád, for your presentation. I'm wondering about the population size in these studies, like how many patients they included, and did this study mention how they collected the data about the OGTT tests and for the patients?
Thank you for your question. Almost all of my studies are experimental studies, so either randomized or not randomized, and the sample sizes, there were like around between 10, 15, 20, and like 150. So not that big of a sample sizes, but we have a lot of articles, so altogether they might give us a high number of patients that could be examined.
And why do you think some contraceptives will have a positive effect and the others will have a negative effect?
Yeah, this could be something that's interesting. So there could be contraceptives that have a net positive, a net negative, or or no alterations at all. So this is something that we could look at if we have the final results after we have the model.